The silent killer, hip fracture. The shocking truth of 20% mortality and the key to prevention. Can a simple fall lead to death? It might be hard to believe, but it is a harsh reality. Every year, the number of deaths from hip fractures worldwide exceeds the number of deaths from traffic accidents. An even more shocking fact is that 20% of hip fracture patients die within a year, and 50% completely lose their ability to walk independently. Do you think, I'm still young, so I'll be fine? 3 out of 10 seniors over the age of 65 fall every year, and 5% of these falls result in a hip fracture. But it doesn't end there. A person who has experienced a hip fracture once is at more than double the risk of a refracture, creating a terrifying vicious cycle of fracture chain reaction. So, why is a hip fracture so deadly? And how can we protect ourselves and our families from this silent killer? Today, we're going to uncover the hidden truths about hip fractures and the specific ways to prevent them. Why is a hip fracture so deadly? A fatal injury that destroys the body's central axis. The hip joint is a crucial part of our body, acting as its central axis. It bears the entire body's weight and is the starting point for all basic movements, like walking, sitting, and standing. When it breaks, it's not just a single bone that breaks. It's the collapse of the entire body's balance system. The most significant characteristic of a hip fracture is immediate inability to walk. Unlike other fractures, a hip fracture instantly confines the patient to bed. This isn't just an inconvenience. It's the beginning of a serious, life-threatening situation. At the end of the video, we have some tips for hip injuries and their after effects. So please watch until the end. Haven't you subscribed yet? Please hit the subscribe and like buttons below. And please share this with your loved ones. Now, let's talk about the main causes of hip fractures and specific prevention methods. A cascade of complications, the domino effect, leading to death. The reason hip fractures are so fatal is not the fracture itself, but the cascading complications that follow. Long-term bed rest leads to a variety of simultaneous complications, including pneumonia, pressure ulcers, blood clots, and muscle atrophy. Pneumonia is the most common cause of death for hip fracture patients. When you lie down for a long time, lung ventilation decreases and phlegm accumulates, making bacterial infection more likely. In elderly patients with weakened immune systems, pneumonia can progress to sepsis, which can be life-threatening. Blood clots are another terrifying complication. When you don't move for a long time, blood circulation slows and clots can form in the leg veins. If these clots travel to the lungs, they can cause a pulmonary embolism, leading to sudden death. Muscle atrophy and osteoporosis also progress rapidly. Just 2 weeks of bed rest can reduce muscle mass by more than 20%, and bone density can drop sharply. This greatly increases the risk of refracture even after recovery. Surgical risks and difficulty in recovery. Most hip fractures require surgical treatment. However, the majority of patients who suffer hip fractures are elderly and have underlying health conditions, which makes surgery risky. The dangers of general anesthesia, bleeding during surgery, and infections can be life-threatening. Even if the surgery is successful, the recovery process is challenging. Unlike young people, the bones of older adults heal more slowly and muscle recovery is difficult. Many patients do not regain their previous level of activity and become dependent on a wheelchair or walker. Key causes of hip fractures. 1. Osteoporosis, the silent thief that gnaws away at your bones. Osteoporosis is the most significant cause of hip fractures. It reduces bone density and weakens the microstructure, making bones prone to breaking from even minor impacts. In postmenopausal women, osteoporosis progresses rapidly due to a decrease in estrogen. The terrifying thing about osteoporosis is that it's a silent disease. It often has no symptoms until a fracture occurs. Because fractures can happen during normal activities, it is also referred to as a pathological fracture. According to studies, the risk of a hip fracture in a patient with osteoporosis is more than 10 times higher than in a person with normal bone density. A person with severe osteoporosis, T-score below 2.5, is at constant risk of fracture. 2. Falls, the unpredictable moment of danger. Falls are the direct cause of hip fractures, with over 90% of hip fractures in seniors, over 65 resulting from a fall. However, a minor fall that would be harmless to a young person can be fatal to an older adult. The causes of falls are varied: poor vision, leading to an inability to see obstacles, weakened muscles, causing a loss of balance, dizziness from medication side effects, and cognitive decline, leading to poor judgment. Especially in winter, slippery sidewalks, wet bathroom floors, poorly lit stairs, and loose carpets or rugs are all common hazards in daily life. Statistics show that over 70% of senior falls occur inside the home. 3. Muscle loss, sarcopenia. When the body's support system collapses, as we age, muscle mass naturally decreases, a condition called sarcopenia. Muscle mass decreases by 1 to 2% annually, starting around age 30, and by age 70 you may have only 30–40% of the muscle mass you had when you were young. Muscles act as a natural cushion, protecting bones. When you fall, your muscles absorb the impact and reduce the force transmitted to the bones. When muscle mass decreases, this protective function weakens, making a fracture more likely from the same impact. In addition, muscle weakness impairs balance and walking ability, increasing the risk of falls. Weakness in the thigh muscles, quadriceps and gluteal muscles. Glutes significantly reduces stability around the hip joint. 4. Diseases and medications. Hidden risk factors. Various diseases such as diabetes, thyroid disease, and rheumatoid arthritis can negatively affect bone health and increase the risk of hip fractures. Diabetes can impair nutrient supply to the bones by damaging blood vessels, while hyperthyroidism can promote bone resorption, reducing bone density. Certain medications can also be risk factors. Long-term use of steroids can cause osteoporosis, and diuretics can increase calcium excretion. Additionally, sleeping pills, antidepressants, and blood pressure medications can cause dizziness or orthostatic hypotension, increasing the risk of falls. For patients taking anticoagulants blood thinners, a fall can cause severe bleeding, making surgery even more dangerous. Hip fracture prevention life-saving practices. 1. Osteoporosis prevention and management. Building a foundation for bone health. The core of osteoporosis prevention is a sufficient intake of calcium and vitamin D. Adults need 1,200 milligrams of calcium and 800–1,000 IU of vitamin D per day. Calcium is abundant in dairy products like milk, cheese, and yogurt, as well as in anchovies, bone-in fish, and green vegetables. Vitamin D is synthesized in the skin through sun exposure, so it's good to get about 15–20 minutes of sun a day. However, during the winter, or for those who spend a lot of time indoors, taking a vitamin D supplement can also be helpful. Regular bone density tests are also important. After age 50, you should have a DEXA scan every 2–3 years to check your bone density. If osteoporosis is diagnosed, you should receive appropriate medication. Current osteoporosis treatments have been proven to reduce fracture risk by 30–70%. 2. Muscle strengthening exercises. Creating the body's natural shield. Muscle strengthening exercises are one of the most effective ways to prevent hip fractures. You should focus on strengthening your lower body. Exercises like squats, lunges, and stair climbing strengthen the thigh and glute muscles, protecting the hip joint. Exercise also provides the right stimulus to the bones, helping to increase bone density. Weight-bearing exercises that resist gravity walking, jogging, stair climbing are particularly effective. A regular workout of 30 minutes or more, 3 to 4 times a week, is recommended. Balance training is also crucial. Exercises like standing on one foot, walking with eyes closed, yoga, and Tai Chi improve balance and prevent falls. Research shows that seniors who undergo balance training can reduce their fall risk by more than 30%. 3. Creating a safe living environment. Removing dangers in the home. Improving the home environment is key to fall prevention. First, you should remove all obstacles on the floor. Cords, carpets, rugs, newspapers, and magazines on the floor can cause you to trip and fall. Improving lighting is also important. Install sufficient lighting in all hallways and stairways, and place night lights along the path from the bedroom to the bathroom. Place switches in easily accessible locations and consider using voice-activated lighting if needed. Bathrooms and stairs are particularly dangerous. Install grab bars in the bathroom and lay down non-slip mats on the floor. On stairs, install handrails on both sides and attach anti-slip tape to each step. 4. Using appropriate mobility aids, safety over pride. You should not be embarrassed to use mobility aids. Canes, walkers, and wheelchairs are excellent tools for preventing falls. If your balance is poor or your muscles are weak, don't hesitate to use a mobility aid. Shoe choice is also important. Avoid high heels, overly loose shoes, or shoes with slippery soles. It's best to choose shoes that fit well and have a non-slip bottom. Hip protectors are also an effective aid. They can reduce the impact on the hip joint by 50–80% when you fall sideways, helping to prevent fractures. Their use is strongly recommended for high-risk individuals with severe osteoporosis. 5. Regular health management. Early detection and proper treatment. Regular health checkups are essential to detect and treat diseases that increase fracture risk, such as osteoporosis, diabetes, and thyroid disease at an early stage. Women in particular need to be careful, as bone density decreases rapidly after menopause. You should also have regular vision and hearing tests. Impaired vision or hearing can make it difficult to perceive your surroundings, increasing the risk of falls. If necessary, wear glasses or a hearing aid to compensate for sensory function. Your medications should also be reviewed regularly. If you're taking any drugs that cause side effects like dizziness, drowsiness, or orthostatic hypotension, you should discuss adjusting or changing them with your doctor. If a fracture occurs, quick action saves lives. Emergency response. If a hip fracture is suspected, you must provide immediate first aid. Do not move the patient and call 911 or your local emergency number from the spot. Trying to move them can worsen the fracture or damage surrounding blood vessels and nerves. You can apply an ice pack to help with the pain, but do not put it directly on the skin. Wrap it in a towel. If the patient loses consciousness or shows signs of shock, secure their airway and elevate their legs above heart level. The importance of treatment and rehabilitation. Hip fractures have a golden hour. Receiving surgery within 48 hours of the fracture can significantly reduce the risk of complications and death. Therefore, a quick diagnosis and surgical plan upon arrival at the emergency room are crucial. Rehabilitation after surgery is the key to recovery. You should start by practicing sitting up in bed as soon as possible, and then progressively work on walking training. Physical and occupational therapy are important for regaining muscle, strength, and balance. Nutrition is also essential. A sufficient intake of protein, calcium, and vitamin D is necessary to promote bone healing. Maintaining overall health through adequate hydration and regular meals is also important. The role of family and society. The concern and support of family members. Preventing hip fractures has its limits with individual effort alone. It requires the concern and support of family members. You should help an elderly loved one. Check their living environment and remove risk factors. Regular check-ins and monitoring of their health are also important. If you notice changes like an unstable gait or frequent falls, you can take appropriate action early. Social support systems. At the community level, efforts to prevent hip fractures are also necessary. Examples include adding safety features to public facilities, offering exercise programs for seniors, and supporting health screenings. Healthcare professionals also have a role to play. They can prevent fractures through proactive screening and prevention, education for high-risk individuals with osteoporosis, and by prescribing appropriate treatments. Conclusion: prevention is the best cure. A hip fracture is a preventable disease. It can be prevented through osteoporosis management, regular exercise, creating a safe environment, and using appropriate mobility aids. The most important thing is to have a prevention mindset. As we age, our bodies naturally change. It's important to accept and acknowledge these changes, while also putting in the best effort we can. A healthy old age doesn't come on its own. It's built through continuous preparation and management from a young age. Start with small actions today. You can begin with simple things like taking a 15-minute walk daily, checking your home for hazards, and getting enough calcium and vitamin D. Your small efforts will create a big change that can save a life. Protecting yourself and your family from the silent killer of hip fractures is the first step toward a healthy and happy old age. Thank you for watching until the end.